Good evening, class. Did you know, according to the Center for Disease Control and Prevention, the average life expectancy of an American is 78.7 years? However, did you know that after a study conducted by the American Heart Association for someone who uses anabolic steroids, their life expectancy is only 40 years old? Some of these steroid users were Ali Cooney, who died at 20 years old, David Singh, who died at 27 years old, Scott Klein, 30, Matt Mensier, 47, Dan Dukjan, who is 47, and Don Ross, 55. Again, these are only a few people who passed away from using anabolic steroids, but it gives you an idea of the age range and how early in life they actually passed away due to using anabolic steroids. The scary thing is that not only adults use steroids. There has been studies done by the National Institute of Drug Abuse who showed that even 8th graders use anabolic steroids. In a study they did, 1% of 8th graders used or do use anabolic steroids. And then looking at 10th graders, it was 1.4%. Looking at 12th graders, it was 1.9%. So steroids aren't just used by adults. Due to people having such an easy access to this drug, it is possible that your kid or niece or nephew or a sibling or maybe a friend or just someone you care about might actually get access to it and try it. And this is scary because it is very bad for your health, and we'll talk about this in the next few minutes. To better understand the issue, though, I will go over the different types of steroids, the risk that go along with them, and tell you how we can help deter people from using them. First, we'll look at the different types of steroids. There are some steroids that are good for you and should only be prescribed to you and given to you by a doctor. The ones that the doctors use can help certain diseases, and they're taken by oral, inhaler, intranasal spray, topical ointments, and by injection. One of these good kinds of steroids that doctors can use for you is corticosteroids. This was written by the Mayo Clinic organization, as well as others. But this steroid is used to treat rashes, lupus, and asthma. In the Health Encyclopedia of the University of Rochester Medical Center, there are other good steroids that are made by your body, such as sex hormones, mineralocorticoids, biosalts, bioacids, and lastly, sterols. These steroids are found to help male testosterone, female hormones, immune system, balance of sodium and potassiums, help digestion and absorption of fats, and build up cell walls. But these are the good kind that either your body makes automatically or that a doctor can prescribe to you or use to help treat something that you have. Now, looking at the bad type of steroids is anabolic steroids. These steroids are man-made. The University of Rochester stated that the use of anabolic steroids can increase the risk of prostate cancer, stroke, and heart attack. The National Institute on Drug Abuse wrote that anabolic steroids use can lead to brain damage, kidney failure, cardiovascular problems, and again, heart attack and stroke. Furthermore, NIDA said that it can give you severe acne. These are only a few of the side effects that we know of that you can get from the use of steroids. So, to help let that all sink in for you, I have a few pictures for you to look at, and we'll go over what they are and this is how you can tell if someone is having a side effect of using steroids. First, we'll look at this photo here. This was a man who used steroids when he was 20 years old. The picture above shows when he was still on the steroids, and he's very muscular, and he has a little bit of acne that you can't really see very well in the picture, but very easily noticed on the lower picture that he ended up getting that severe acne after he stopped the use of steroids. This next photo is a picture of a gentleman who developed gynecomastia, which is development of breasts. This picture here shows an indent on a male's butt where he repeatedly injected himself with steroids. These are only a few photos that I got for you in order to help let that sink in. However, for women, they can grow facial hair as well. They can develop male balding patterns. They get a deeper voice. And then looking into adolescence, using steroids can stunt their growth because of premature skeletal maturation. But those are things that you cannot see on the outside, but are still side effects of the use of steroids. Now that we know what the steroids are, how are we going to stop the use for steroids? Well, first off, we need to raise the penalty for someone who is caught with steroids. Currently, the penalty for someone who's caught as a first offense is up to 1 year in prison and a fine of $1,000. The prison time seems a little fair. However, most people don't even serve that whole time. For a professional athlete as well, they could even care less about a $1,000 fine. They're making millions of dollars. And even for a middle class person, that isn't even a big enough fine for them to really care as much. So I suggest that we raise the penalty to $10,000 so that everyone takes it more serious on how bad this drug is if people begin to use them. Also, currently, for a second offense, it is only a minimum of 15 days imprisonment. This is ridiculous to think about. 15 days is not enough time for someone to think about their actions. The minimum should be at least 90 days, if not more. However, we shouldn't just focus on how to punish people who do use them or traffic this disgusting drug, but we should also mentor our friends and family about the negative side effects that this drug can have on them. So the way we're going to do that is if we vote on raising this punishment for drug use, and if we mentor our friends and family, then it will deter most people from even using it once, if not deterring everyone completely from using this horrible drug. If we succeed in deterring people from using it, then we don't have to worry about any of our loved ones getting one of these, or even more than one of these, health damaging side effects. Also, if we succeed, we don't have to hear about professional athletes using this drug. And that's very important, because if we stop the athletes from using it, this will cause a ripple effect, and our kids and our young family members, or just people in general in the community, they may as well be deterred from even trying steroids once. Because I don't know about you, but for myself, and I know a lot of people that looking up to professional athletes, they're role models for us as children. So if our kids or young siblings see that professional athletes stay away from steroid use, then they'll think to themselves, well, if that guy doesn't need it or that girl doesn't need it to be a successful professional athlete, then I don't need it either to be successful. Instead of thinking to themselves, well, I need to use anabolic steroids to be successful just like they did. So that's why it's important that we stop everyone even professional athletes from using this drug. So, it is very clear that there is a problem with anabolic steroids. So, we need to make stricter laws against anabolic steroid use, and we need to help mentor people, our friends, our loved ones, our family members, and the damages it can do to them if for some reason they decided or thought about wanting to use it. So remember, even though some steroids are good for you, these steroids are specific kinds and only should be given to you by a doctor. The anabolic steroids are the bad ones, and they're horrible for you. They cause many health issues, as we spoke about earlier, and a lot of times they even cause an early death. So don't let your friends or family members, or even yourself, be the next victim of anabolic steroids. Please help me ensure that penalties for anabolic steroids are raised, and even more severe for people who traffic this disgusting drug, and help me mentor our youth about the harmful effects of anabolic steroids.